Flatulence is passing gas from the digestive system out of the back passage. It's more commonly known as passing wind, or farting. Farting is often laughed about, but excessive flatulence can be embarrassing and make you feel uncomfortable around others. However, it can usually be controlled with changes to your diet and lifestyle. Flatulence is a normal biological process and is something everyone experiences regularly. Some people pass wind only a few times a day, others a lot more, but the average is said to be about 5 to 15 times a day. When you swallow food, water or saliva, you also swallow small amounts of air, which collects in the digestive system. Gases can also build up. When you digest food, the body needs to get rid of the buildup by farting, flatulence, or burping, belching. Sometimes you may not notice you have passed wind because most of the gases are odorless and often released in small quantities. Flatulence usually only has a bad smell if it contains gases that smell, such as sulfur. However, it's important to remember it's normal for the gas you pass to sometimes smell a bit. Excessive flatulence can be caused by swallowing more air than usual or eating food that's difficult to digest. It can also be related to an underlying health problem affecting the digestive system, such as recurring indigestion or irritable bowel syndrome, IBS. There are no medical guidelines defining the normal frequency or volume of flatulence. You're probably the best person to assess your own symptoms. See your GP if your flatulence is particularly troublesome, for example, if you're frequently passing smelly gas. You should also visit your GP if you experience additional symptoms, such as persistent abdominal pain and bloating, recurring episodes of diarrhea or constipation, unexplained weight loss, bowel incontinence, blood in your stools, feces, and signs of an infection, such as a high temperature, vomiting, chills, joint pain and muscle pain. These symptoms could be an indicator of a more serious health problem and may require investigation, such as a blood or stool test to look for an infection. Excessive flatulence can usually be controlled by making changes to your diet and lifestyle, such as avoiding foods known to cause flatulence, eating smaller and more frequent meals, eating and drinking slowly, and exercising regularly. There are also some over-the-counter medications that can help if your flatulence is troublesome, such as charcoal tablets or simethicone. If your flatulence is related to an underlying health problem, treating the condition may help resolve it. There are several natural causes of flatulence. Flatulence can also be caused by some health conditions related to the digestive system, or as a side effect of certain medicines. It's perfectly normal to swallow air while breathing and eating. However, it's easy to swallow a lot more air than usual without realizing it. This can cause excessive flatulence. Excess air can be swallowed by chewing gum, smoking, sucking on pen tops or hard sweets, having loose-fitting dentures, and not chewing food slowly and thoroughly. Swallowing large pieces of food causes you to swallow more air. Hot and fizzy drinks also increase the amount of carbon dioxide in your stomach, although this is more likely to cause belching rather than flatulence. Some carbohydrates in food can't be digested and absorbed by the intestines. These pass down into your colon to be broken down by bacteria, producing gas, which is released as flatulence. Foods containing a high amount of unabsorbable carbohydrates include beans, broccoli, cabbage, cauliflower, artichokes, raisins, pulses, lentils, onions, prunes, apples and Brussels sprouts. Foods containing a lot of unrefined cereal fiber, such as bran, can also sometimes cause problems with wind and bloating. Other foods and drinks that contain a sweetener called sorbitol, such as sugar-free gum or slimming products, or a type of sugar called fructose, such as fruit juice, can also cause flatulence. This means chewing sugar-free gum can cause flatulence from both the sweetener and swallowing air. Certain foods, such as cabbage or onions, can lead to the production of gases containing sulfur, which can result in foul-smelling wind. However, the production of smelly wind can vary from person to person depending on what you eat, so it's up to you to work out which foods cause the most smell. Certain health conditions can cause symptoms of flatulence, including indigestion, constipation and irritable bowel syndrome, IBS, a common digestive condition, which can cause stomach cramps, bloating, diarrhea and constipation, celiac disease, an intolerance to a protein called gluten, found in wheat, rye and barley, lactose intolerance, where the body is unable to break down lactose, a natural sugar found in milk and dairy products, and can't absorb it into the blood, gastroenteritis, a stomach and bowel infection, malabsorption, where the intestines are unable to absorb nutrients properly, and giardiasis, an infection of the digestive system caused by tiny parasites. Flatulence, often caused by indigestion, is a possible side effect of many types of medicine, including non-steroidal anti-inflammatory drugs (NSAIDs) such as ibuprofen, some laxatives, antifungal medicines, statins, and varenicline Champix used to help people stop smoking. Source: NHS Inform.